I have a breast cancer on my left side, and this I detected one day, January, in the year 2009. As I was dressing, I saw a depression, a devil like under my breast. Then in March, I was referred to a pathologist who did the biopsy. I stayed for 3 days. I went for the results. The results were positive that the cells there are cancerous.
Safari yangu ya kansa tulianzana naye August last year. Hapo ndio nilisikia ufeedback. Ndio nikaenda hospitali wakanifanyia kitu kinaitwa ultrasound. Mwenye kunifanyia hiyo akaniambia this is non-cancerous. Alafu December kaza mshumu. Natumai tukaanza kutoka kwa hiyo karibu na hivi na titi yenyewe kaanza kutoka maji. Sasa nikajiuliza na waliniambia sio kansa tena ila ni nini. Okay. Hiyo nikachukua jukumu la kwenda kwa daktari sasa. Biopsy ikasema hakuna kansa. Machi tulianza sasa hapa. Hapa ndio nikaona madaktari hapa. Wakanipea tamoxifen. Endelea kumeza. Kama titi yenyewe imepona. Lakini sasa huku kwingine hii ingine ilikuwa imesambaa. Hakuna kupona. Hata hivyo naomba zaidi.
For breast cancer to be diagnosed early, then you will not have any signs and symptoms, and that's why we recommend for screening, because there are patients who come with breast cancer and they have no symptoms. However, having said that, most of the signs and symptoms of breast cancer include one, a lump in the breast, which may be painful or painless. Secondly, skin changes. The skin of the breast becomes very shiny. Another presentation is nipple retraction, where the nipple pulls back. Sudden change in the size of your breast, where maybe one becomes bigger than the other one, more than usual. Another one is nipple discharge. You also could have a presentation with the lymph nodes swollen in the armpit and sometimes around the collarbone.
I was given options for treatment. I was told you can be on drug until those lumps disappear. You can be given radiotherapy and they also can disappear. And the final one, the doctor told me there's another better option, but it is somehow bitter, but it is the best. Nikamuuliza which one? Total mastectomy. Well, me, I hoped for that one. After that, I booked a surgeon March 23rd.
The treatment for breast cancer depends on the stage. If it's early stage, surgery is very important. In late stages, then patient may benefit from surgery with addition of chemotherapy and radiotherapy, plus or minus hormonal treatment for 5 to 10 years.
That mastectomy was done. It was successful. I got up. Then after that, I stayed the whole of April draining the knee. The scar was okay after I think a month. The scar healed for the surgery. Then in June, I started this chemotherapy after every 3 weeks. First time, it was after every 3 months. The first year, 6 months. Then it went to a year, up to date.
Once patients finish active treatment, we continue following them up in their care. And we usually start giving them a short appointment. That ranges from 2 weeks to 1 month. And once we find them that they're doing so well, we increase their follow-up their appointment dates to 6 months. And if we find that they're doing well, we continue following them even yearly. We have a case of patients who are following yearly. A case in mind is like Jane, who has is a breast cancer survivor.
Tunahimiza wazee wa rika yako, vijana na wanaume, mwanaume wote mahali hapo, ukisikia kaushungu, kaufide, tafadhali usikae nyumbani na usijitibu. Sababu ukijitibu unaweza jitibu utibu ile ugonjwa haujui, alafu sasa wakati ndo utaonekana na daktari, basi ikuwe sasa imefika stage 4 kama yangu.
Breast cancer in men is rare. It actually accounts for 1% of all the breast cancers, and the risk factors are similar to the women, but except about breastfeeding and having children. So for men, the main risk factors include having breast tissue, growing older, and sometimes genetic factors come into play, and also sporadic cases where you cannot identify any risk.
Kansa sio ugonjwa ya kujua. Watu wasiogope. Uoga huo ndio unatumaliza. Hata sababu uko na kansa, umepatwa na kansa, na daktari amekuambia kuna kansa, badala ya ukubali na ujikubali wewe mwenyewe kwenda safari.
By that time, before I get the first prognosis, I could have a lot of scars to balance myself, to cover this. Sometimes you put cotton wool, pieces of clothes, but you know they cannot be like the normal breast. Well, so Kenyatta has been helping me to survive in that, and when I come, we also find people who encourage us and tell us this is just normal life, like another disease.
As a hospital, one of our core mandates is to build capacity even in the counties. So we've been partnering with the Ministry of Health to formulate cancer screening guidelines, which we are being disseminated to the counties for what are the common cancers that needs to be screened for. And we do actually partner with the ministry in rolling out the awareness. Like this year, we participated in the launch of the Breast Cancer Awareness Month. As a hospital, we also do screen walk-in patients for cancer, and we have facilities both from radiology to laboratory to diagnose cancer, and we have theaters for operation, and we do have cancer treatment machines like radiotherapy machines for offering the same, and we have an outpatient chemotherapy center to offer treatment for breast cancer patients.
Vijana, hata you young boys, cancer is severe. Na breast cancer kwa wazee, hata kama mkamadili yako ni kadogo, hata hapo ni candidate kwa cancer. Na usiogope, ikipata usiogope, sababu matibabu iko. Bora tu ujiseme. Our doctors are qualified. They will treat you. Initialize every call, itakusaidia na utatoboa.
You need to accept yourself so that other people can accept you. So my fellow colleagues, it's the high time we accept ourselves and know that God has a plan for us, and we are living like any other person.
As we commemorate the Breast Cancer Month, we urge all the population outside there, both men and women, to go for eye screening.
It is important for women over the age of 35 to go for a screening mammogram, at least a baseline at 35 years of age, and probably then do it depending on the risk and what the doctor would recommend. You do it every 1 to 3 years. And then it's also important that you don't wait for symptoms. You go to the doctor just to be checked. There are screening tests we do depending on the age. We can do a mammogram. We can also do an ultrasound if you are a younger woman. And obviously, if you have a very strong history in your family of breast cancer, then it's important for you to even go for screening more regularly. Cancer is not a death sentence. There's always hope. And this year's theme is spread hope, and save lives. So if you have cancer, don't hide, because cancer is not a communicable disease. You're not going to infect the other person, and we encourage family members to support the cancer patients through this difficult journey.